And then I started playing soccer when I was 5, and around age 13 started getting real competitive. And I would say between age 13 to 17, I ended up getting about 7 or 8 concussions from playing soccer. And then a lot of weird stuff right when I was 30 started happening. So my hand would go completely numb and I would like hit it to get the feeling back. I would get floaters in my vision, watery eyes. So I actually Googled, and a Dr. Lim video came up through social media, and I just had that feeling from above, that's where I need to go. I need to get to this guy.
When I had the honor of meeting Ms. Sharapata, she had come to me after doing extensive homework. She had been suffering from this for years and really had exhausted her medical options. Amongst the different options that we discussed with her was the microvascular decompression after I saw a blood vessel touching her nerve. So we proceeded, and when we did the microvascular decompression on her first side, she woke up in no pain, and she was ecstatic and happy that her pain was finally gone. And so after seeing her get pain relief, we quickly moved on to doing the second side. And I'm so thrilled to see now that we've been able to address her face pain.
What we have seen is that there seems to be an association between trigeminal neuralgia and occipital neuralgia, which I treat, but these mechanisms for this association are very poorly understood. While there are some connections between these nerves and the upper cervical spinal cord, there really are very distinct pain syndromes. But we've still observed in numerous patients that there seems to be an association between these two nerves and the problems that they can create. In November 2024, Sheena decided to move forward with surgery for her greater occipital neuralgia. This type of surgery involves an incision on the back of the scalp, and there is a greater occipital nerve on both sides of the scalp, and she was having issues related to both of those. The goal of the surgery is really to free up those nerves from anything that might be pinching them. And this can be a whole variety of different things that can sometimes be the pathological cause of the symptoms that the patient is having. At the end of the operation, I was really happy with the way both her left and right greater occipital nerves looked. They seemed to be free of anything that would be pinching or entangling them. And I thought that set her up for a really good chance of success after the operation.
The best thing I've heard and seen for myself is they are so good with any follow-up. If you have a problem, they will email you back, call you back. It's not like you go get a procedure and like, okay, bye, on to the next one. They're really there for the long term for you. So to have that medical team brings a sense of comfort. If something happens, you know where to go. I think all these surgeries, it's such a huge blessing because I found my purpose in this life. And sometimes you have to go through all the bad and you feel like you're stuck in it and where am I going? But you have to physically live it to understand it, to be able to help other people.